What if I told you that a disease capable of taking your life could be growing inside your body for years, without causing severe pain, without making you feel seriously ill, and without giving you a reason to see a doctor? That's the terrifying reality of colon cancer. It's one of the few cancers that can remain almost completely silent while it slowly grows stronger. By the time many people realize something is wrong, the disease has already advanced. And that's why doctors continue to stress one powerful message: early detection saves lives. But here's the question: would you recognize the warning signs before it was too late? Meet James. He's 61 years old. Like millions of Americans, James believed he was in good health. He stayed active. He enjoyed weekend barbecues with his family. He rarely missed work. And aside from the occasional stomach discomfort, there was nothing that seemed out of the ordinary. Or so he thought. It started with subtle changes. He noticed his bowel habits weren't as predictable as they used to be. Some days, he felt constipated. Other days, he rushed to the bathroom without warning. Then one morning, he noticed a small amount of blood after using the toilet. It'll probably go away, he told himself, and it did. At least for a while. So James ignored it. Weeks turned into months. The fatigue grew worse. His clothes began fitting a little looser. He found himself losing weight without trying. Still, he convinced himself it was simply part of getting older. Until one ordinary afternoon changed everything. His doctor walked into the examination room carrying a folder of test results. The room fell silent. Then came the words that instantly divided James's life into before and after. James, you have colon cancer. At that moment, countless questions flooded his mind. How could this happen? I wasn't even that sick. Were the signs there all along? The heartbreaking answer was yes. Colon cancer rarely arrives with flashing warning lights. Instead, it often whispers, a little blood, a little fatigue, a small change in your daily routine. Symptoms so ordinary that thousands of people dismiss them every single day. But what if those seemingly harmless changes were actually your body's desperate attempt to get your attention? Over the next few minutes, we'll uncover how colon cancer begins, the silent warning signs most people overlook, who is most at risk, and why one routine screening test has saved countless lives. Because by the end of this documentary, you may never look at a minor stomach problem the same way again. And what you'll discover next explains why colon cancer can remain hidden for years before anyone suspects it's there. How colon cancer begins, the silent warning signs most people miss. To understand why colon cancer is so dangerous, we first need to understand where it begins. The colon, also known as the large intestine, is one of the hardest working organs in your body. Every day, it absorbs water, processes waste, and helps prepare your body to eliminate what it no longer needs. For most of your life, it performs this job quietly. You rarely think about it, until something goes wrong. For many people, colon cancer doesn't appear overnight. It often begins as a small growth inside the lining of the colon, called a polyp. Most polyps are harmless. Some may remain unchanged for years, but certain types can slowly develop abnormal cells that, over time, become cancer. This transformation usually doesn't happen in weeks or months. It can take years. That's one reason colon cancer is considered one of the most preventable cancers. If precancerous polyps are found during routine screening and removed, cancer may never develop. The challenge is that these changes usually happen without causing obvious symptoms. There is no alarm, no sudden collapse, no unbearable pain. The disease quietly progresses while life carries on as usual. The silent warning signs. For James, the first warning sign seemed almost too small to matter. His bowel habits began to change. Sometimes he was constipated. Other times he experienced loose stools without any clear reason. At first he blamed stress. Then he blamed something he had eaten. But when these changes continue for several weeks or keep returning, they shouldn't be ignored. Persistent changes in bowel habits deserve medical attention because they can have many causes, including colon cancer. Next came abdominal discomfort. Not severe pain, just occasional cramping, a feeling of bloating, sometimes pressure that came and went. These symptoms are common and often caused by non-cancerous digestive conditions. But when they persist or gradually worsen, it's important to speak with a healthcare professional rather than assuming they'll disappear on their own. Then came the symptom that caught his attention, but not enough to make him act. He noticed blood after a bowel movement. It wasn't much, just a small amount. He convinced himself it was probably hemorrhoids, and sometimes that's exactly what it is. But blood in the stool or rectal bleeding should never be ignored, even if it happens only once. Only a proper medical evaluation can determine the cause. Over the following months, another change slowly crept into his life. He was tired all the time. Not the kind of fatigue that disappears after a good night's sleep. A deep exhaustion. Simple tasks became more difficult. By the end of the day, he felt completely drained. In some cases, slow bleeding from a colon tumor can lead to iron deficiency anemia, leaving the body with fewer healthy red blood cells to carry oxygen. That can result in persistent fatigue, weakness, and shortness of breath. Then something else happened. Without changing his diet, without exercising more, he started losing weight. At first, he welcomed it. Friends even complimented him. But unexplained weight loss, especially when combined with other symptoms, can sometimes be a sign that something more serious is happening inside the body. By the time James finally decided to see his doctor, the disease had already been growing silently for years. And what doctors discovered during a routine colonoscopy changed everything. But who is most likely to develop colon cancer, and how can doctors detect it before symptoms appear? That's where the story takes an important turn. Who is most at risk? The screening test that can prevent colon cancer. One of the biggest myths about colon cancer is that it only affects very elderly people. The truth is more complicated. While the risk increases with age, especially after 45, colon cancer can affect younger adults as well. In recent years, doctors have seen a concerning rise in cases among people under 50, although the reasons are still being studied. For most people, the greatest risk factor is simply getting older. But age isn't the whole story. If a close family member, such as a parent, brother, sister, or child, has had colon cancer or certain types of colon polyps, your own risk may be higher. Certain inherited genetic conditions can also increase the likelihood of developing the disease. Lifestyle may play a role as well. Research has linked smoking, heavy alcohol use, obesity, physical inactivity, and diets high in processed or red meat with an increased risk of colorectal cancer. On the other hand, regular physical activity, maintaining a healthy weight, and eating a diet rich in fruits, vegetables, and whole grains are associated with better overall colon health. Still, it's important to remember this. Some people with several risk factors never develop colon cancer, and some people with few known risk factors do. That's why no one should assume they're completely safe or that they're certain to get the disease. The test that can find cancer before it starts. Perhaps the most remarkable thing about colon cancer is this. Unlike many other cancers, doctors can often find and remove precancerous growths before they become cancer. That opportunity comes through screening. One of the most effective screening methods is a colonoscopy. During this procedure, a doctor uses a thin, flexible camera to examine the inside of the colon. If polyps are found, they can often be removed during the same procedure, reducing the risk that they will develop into cancer later. Depending on your age, risk factors, and medical history, your healthcare provider may also recommend stool-based screening tests that can detect hidden blood or abnormal DNA associated with colorectal cancer. If one of these tests is abnormal, a colonoscopy is usually recommended to investigate further. Current screening recommendations vary depending on individual risk, but many average-risk adults are advised to begin screening around age 45. Your healthcare provider can help determine what's appropriate for you. When James finally took action, after months of ignoring the warning signs, James finally scheduled an appointment. His doctor listened carefully. Because of his symptoms, a colonoscopy was recommended. James admitted he was nervous. Like many people, he had heard stories about the preparation and worried about the procedure itself. But afterward, he had one overwhelming thought. I wish I had done this sooner. The colonoscopy revealed a tumor. A biopsy confirmed it was colon cancer. The news was devastating. But there was also hope, because although the cancer required treatment, it had been found before it had spread to distant organs. His doctors explained that he had options. A team of specialists worked together to create a treatment plan tailored to his condition. For James, the journey was only beginning. But because he finally sought medical attention, he had a chance to fight. The months ahead would test his strength. There would be fear. There would be uncertainty. But there would also be resilience, and a lesson that every viewer should hear. Because sometimes, the most powerful treatment begins with one simple decision: getting checked before it's too late. A second chance, the lesson, James will never forget. A cancer diagnosis changes more than your health. It changes the way you see time. For James, the days after hearing the words, "You have colon cancer," felt like a blur. There were appointments with specialists, more scans, blood tests, conversations with his family that he never imagined having. There were moments when fear seemed stronger than hope. He wondered if he would see another Christmas with his family. He wondered if he would watch his grandchildren grow up. Most of all, he kept asking himself one painful question: what if I had gone to the doctor sooner? After carefully reviewing his test results, James's medical team explained that his treatment would depend on the stage of his cancer and his overall health. He underwent surgery to remove the section of his colon containing the tumor. To reduce the risk of the cancer returning, his doctors also recommended additional treatment. The months that followed weren't easy. There were days when he felt exhausted, days when he questioned whether he could keep going. But with the support of his family, his healthcare team, and his determination to recover, James took each day one step at a time. Slowly, his strength began to return. The morning walks became longer. The laughter came back into his home. Follow-up appointments brought encouraging news. His doctors found no evidence that the cancer had spread further. For the first time in months, James allowed himself to imagine the future again. Not because the journey was over, but because he had been given another chance. The lesson that could save a life. Today, James shares his story for one reason. He doesn't want someone else to make the same mistake he did. He wants people to know that colon cancer often begins quietly. A small change in bowel habits, blood in the stool, persistent abdominal discomfort, unexplained weight loss, ongoing fatigue. These symptoms don't always mean cancer. Many common conditions can cause them. But if they persist, recur, or concern you, they deserve a conversation with a healthcare professional. Ignoring them doesn't make them disappear. Getting them evaluated could make all the difference. Hope through prevention and early detection. The encouraging news is that colon cancer is often one of the most preventable cancers. Routine screening can detect precancerous polyps before they become cancer. And when colon cancer is found early, treatment is often more successful. That's why knowing your family history, understanding your personal risk, and discussing screening with your healthcare provider are so important. Early action isn't about living in fear. It's about giving yourself the best opportunity to protect your health. Every day, your body tells a story. Sometimes it's loud. Sometimes it's almost silent. The question is, are we listening? Colon cancer doesn't always arrive with dramatic warning signs. Sometimes it begins with changes so subtle they're easy to explain away. But paying attention to those changes and acting on them could change the course of your life. Because in the end, the greatest mistake isn't asking your doctor a question, it's wishing you had. If this documentary helped you better understand colon cancer and the importance of early detection, share it with someone you care about. A single conversation could encourage a friend or family member to seek medical advice at the right time. If you or someone you love has experienced colon cancer, we'd love to hear your story in the comments. Your experience may provide hope and encouragement to someone facing the same journey. And if you enjoy evidence-based health documentaries that explain serious medical conditions in a clear and engaging way, subscribe to the Health Files and turn on notifications so you never miss a new episode. Remember, knowledge doesn't replace medical care, but it can empower you to ask the right questions and seek help when it matters most. Until next time, stay informed, stay proactive, and take good care of your health.